The show is here. Yo, our mission is clear. It's time to change healthcare. Have no fear. Today is the day. This is the hour. Together, you know we've got the power. Drop the silos. We're all the same team. Experience, business, tech, and marketing. How can anyone be satisfied with the way things have always been? Yeah, we tried. So join us now. Join the revolution. Consumer first health is the evolution. Status quo, more like status no. Yeah, this is the healthcare rap. Y'all, come on, let's go. New choices, new platforms, new care models. In the healthcare of tomorrow, consumers win. But who will design it? What will it look like? And how long will it take? We're here to answer those questions with some provocative thinking about how to create the healthcare that people actually want. Ready to roll up your sleeves, look at the world a little differently, and explore the frontiers of consumer health together? Join us. This is the Healthcare Wrap. Welcome back. I'm your host, Jared Johnson, and here's what's going to go down today. We have the Flava of the week about the rumors that CVS is exploring an acquisition of Oak Street Health. So, can retailers, hospitals, and value-based primary care coexist? And can a less hospital-centric version of healthcare benefit everyone? I'll talk about that. Then it's our 250th episode. Celebrate with us as Zain and I give a state of the state of consumer transformation. We start off by the numbers, sharing some figures from research across the industry about what consumers want and how healthcare organizations are doing meeting those demands. Then we discuss who's trending up and down, and we wrap up by creating a consumer cocktail by mixing in the ingredients that make up consumer transformation. It's time to dive right in. Are you ready? Let's go. Flava of the week. Batter up. Another rumored mega deal, another opportunity to improve the consumer experience. The latest to take a swing is CVS, who according to Bloomberg is exploring a deal to acquire Oak Street Health, which runs primary care centers for Medicare recipients. Reportedly, the two are in ongoing talks and could reach a deal within weeks that values Oak Street at more than $10 billion, including debt. Oak Street operates 169 centers in 21 states. They went public in 2020 and have seen rapid growth and results from their value-based clinical strategy, but they still operate at a loss. They expect to lose over $200 million in 2023 and not reach profitability until 2025 at the earliest. So the retail health carousel continues to spin, but are consumers being taken for a ride? Meaning, as the price tags keep going up, Amazon bought One Medical for $4 billion, CVS bought Signify Health for $8 billion, and VillageMD bought Summit Health for $9 billion. Does the quality of care go down? Do consumers win? Or is primary care just a means to an end? I'm hopeful that what's driving acquisitions like this is at least partly a vision of finding that sweet spot where the long-term growth plan for the business intersects the opportunity to make the transactional parts of the healthcare journey easier. From the consumer's point of view, which I haven't heard that much about in all the hot takes, I could see possible benefits for members to fill prescriptions at more locations or receive discounts maybe at CVS stores. If they have the capacity to scale Oak Street's model, it could potentially bring the benefits of their value-based membership-driven primary care to millions more seniors. The other possibility could be once they have a true primary care delivery structure in place, they could be positioned to connect that with their newfound at-home care capabilities from the Signify Health acquisition. And at that point, you're talking about a true continuum of care that happens all outside of a doctor's office. Which leads me to my final point. As with nearly every headline about the big four retailers, Walmart, Walgreens, CVS, and Amazon, I don't hear a lot about the role of hospitals in all of it. As the consumer health carousel continues to spin, where will they land? If this deal materializes, it feels like we could be 10 billion steps closer to a version of healthcare that's less hospital-centric. And I'm not sure how many times I have to say it, but that's not necessarily a bad thing. Imagine what relief it could give hospitals to focus more on their awesome acute care and specialty care expertise and live in whatever level of fee-for-service that makes them comfortable, and leave the rest to players that can scale value-based care for patients that need it the most. Let's keep exploring this vision where retailers, hospitals, and value-based primary care can coexist for the benefit of everyone. That's another way that we'll build the healthcare of tomorrow. And that's the Flava of the week.
The flow.
All right, let's get into the flow, everybody. Zain is in the house. What's new, Zain?
Hey, Jared. Good to be here. Not much new, really. I'm just excited to be in 2023. We made it. I don't know. I just feel like, and I'm sure we'll get into it in the rest of the podcast. There's just crazy news every week in the digital health space. And so sometimes it's hard to keep track of it all.
It really is. Well, I'll tell you what, we'll do our best to help keep people up to date on what's going on, at least what we're seeing. But you know what? Before we dive into that, I'm curious, you want to give us just some quick thoughts? Here we are, we're reaching episode number 250. Give us some quick thoughts on that.
That's insane. First of all, I never would have thought, I feel like anyone that's in the content production space, like sometimes you struggle to figure out like, what are we even going to talk about? And so I think it's crazy that, and you did most of it in the earlier days. I think it's crazy that we've been able to find content, and this industry is so, ripe and rich and full of disruption and transformation that we've been able to put together 250 episodes to talk about all this. I think that's good. And I think congratulations in order for you for getting everyone this far.
Hey, well, right back at you, man. This has been a team effort all along. I'll tell you real quick, one very short story, right? For our listeners, I'm going to take people back to the spring of 2018. I was sitting in a hospital cafeteria with my colleague, Peter, and we had just been talking about some of the conversations we had been having as part of a marketing and digital team at a hospital, talking with administrators, talking about things like, hey, we should open up our scheduling and do that online, and getting shot down immediately, right? They're like, yeah, the doctors aren't going to do that.
Wow.
and things like that. And we're like, hey, here's an opportunity. Let's be doing, at the time, it was like, hey, let's be doing Facebook Lives every week. Let's have a Q&A with the doctor to answer questions for parents. And they're like, well, how are we going to get that reimbursed? We were excited about some things, but also feeling the challenges of being in the trenches of how do we move a lot of these, at the time, digital initiatives forward? How do we help people see the value of this? And are we the crazy ones in the room for even asking that and saying that's the direction for things? And so we just started talking amongst ourselves. We found an empty storage room on campus and just hit record. And
No
April 1st, 2018, that was episode 1. We've been going every week ever since then. And we were blessed with Peter to be my co-host for a number of years in the early days. And yeah, ever since then, like you said, we have not run out of things to talk about, to bring to people's attention, to share as a call to action and kind of a reality check, all rolled into one. And that's why we're still here. But yeah, you know what? If this industry would just slow down and just be boring, maybe we wouldn't have so much to talk about.
Yeah, like maybe we can start a credentialing podcast that we'd run out of things to talk about really quick, I think. I think for me too, reflecting on the 250th episode, two things also come to mind is just how many people, and, I haven't been in this as long as you have, but since I've been a part of the healthcare wrap, how many awesome people we've met along the way, both in terms of, leaders we've interviewed, and then even some of their support staff that help us get coordinated on calendars. And then just sort of in the broader digital health community, folks that have reached out to us to say hi, to get involved in broader initiatives that we're both leading. I think it's just been tremendous just to see a true community of people growing with us, if you will, and following us and coming up or in partnering with us, if you will, to move the industry forward.
It's so true. I mean, the intro rap used to say digital health is the evolution. Now it says consumer first health is the evolution. Like that signifies everything.
Yes.
We used to be talking about platforms and tools, and we had to do that foundationally. And now we have to talk about like, what was that foundation for? What are we building on top? And yeah, that's a version of healthcare that's easier to encounter. That's the crux of it all. Yep. So yeah, until that happens, I think we probably will keep having things to talk about.
Yep. Yeah. And to your point, like we have, I think, moved the needle both. I mean, hopefully the podcast has educated folks, but as an industry, things have changed. I think I shared one of the first episodes I've ever been on with you, Jared. One of my first jobs when I was still working in Canada, leading innovation at a rural hospital, was convincing the board of directors that we needed to get on social media. Like that was back in 2013, 2012. And it's like, gosh, like now that I look back on that, I'm like, how silly, that was even a fight, and how commodity and how normal that is now for health systems to be extremely active on social. Not even, I guess we're coming up on 10 years. It's 2023. That was still a question. And so I think there has been lots of movement in the system, even though we still look at healthcare as laggards in the digital space.
Yeah, agreed. And I agreed to only share one story. So I won't share another story about talking to a CEO in 2006 and how that conversation went about getting a new website for that hospital. I will skip that. So, but I did share that on LinkedIn the other day, so people can check that out. But what we're going to do today to recognize episode 250 is we're going to kind of create a state of consumer transformation. To the best of our knowledge, we want to share from a few different angles what it means and what consumer transformation looks like right now for healthcare organizations We are focusing primarily, I'd say, on traditional provider organizations, hospitals, health systems, et cetera. But we're going to talk about some of the retail players and commercial players who are in the space as well. So we're going to try this from a few different angles. The first one, I want to just share some numbers, some facts and figures. So this will be our By the Numbers segment. And let me just share a few of these, Zain. I've curated just my own list from consumer research surveys that have been done by vendors, consulting agencies, and even media groups. And these are all recent, like these are all 2022 stats. So these stats are all about the demands that consumers are presenting and sharing about their healthcare. So number one, 81% of consumers say that a good patient experience is very important when interacting with healthcare providers. That's from Redpoint Global. Two other points from that report. 45% of consumers also expect healthcare brands and providers to proactively contact them to help improve their wellness and care.
Shocker.
And then they also reported that 41% of adults will leave their provider because of poor patient engagement. All right, so I'll stop there. What do you think?
Well, it doesn't shock me. And so what I hear behind a lot of those stats, and this isn't going to sound pretty and it may sound ungracious, but like healthcare is commoditizing, folks. Like what I mean by that is, back in the day, maybe healthcare was considered to be an art and a science, and it certainly is. But especially for like low acuity stuff, it's very much a commodity. And so there's less and less of a difference in quality at the low acuity level between different providers, that might compete in any given community or market. And so that means that the only way to really then compete is on experience, right? And it also sort of gives us the insight that consumers, care potentially less, again, at the low acuity level, like who's their doctor. It's more about just getting the service and getting it in a way that they want. And so I'm not surprised at all by some of the stats we just listed off. But what I think is going to be the uphill battle and hurdle is going to be for incumbent health systems and particularly the medical community to accept that and realize that their world, if you will, or their discipline is no longer such a hallowed discipline, so to speak, that the market will forgive them for not having, the same level of experience or courtesies that other highly commoditized or highly consumer-oriented industries would have. And so that's my long rant about that.
No, I like that. A couple more for you here, and then I'll get your reaction on these two. So the average wait time, the average time to get an appointment scheduled in 2022 was 26 days. That was up from 24.1 days in 2017. So, over a 5-year period, that's gone up a couple of days. That's why a group, Merritt Hawkins, they looked at the 15 largest metro areas in the U.S., which implies that wait is most likely longer in rural and underserved areas. So there's that piece.
Yep.
Then there's 70% of people want health systems to be more actively involved with their own health management activities. That's according to Kaufman Hall. And then my last two have to do with switching providers. So 30% of people said they switched providers in the previous year. And this was from just September of 2022. 30% of people said they switched providers in the previous year. And nearly 80% of those, the ones who switched, said that their reason for leaving was the lack of ease of use. So there were things like it was difficult to do business, it was a bad experience with administrative staff, or there was an inadequate digital presence there. And a very similar one, that was 30% against switched providers in the last year. Then Geonetrics survey looked at a 2-year window and found that 43% of people had switched providers in the last 2 years. So, all right, what do you think about those?
I think that sounds about right. So going back to the scheduling, I'm a little bit shocked that number isn't higher, that, the time to get an appointment wouldn't be higher, given, sounds like it's only going up by a few days over the last 3 years. But given where we went through with the pandemic, I would have thought that would have went a lot higher. So I guess that's kind of a good stat to hear. But I laugh because with my Canadian hat on, Jared, a report came out recently in Canada, specifically in Ontario, I believe. And this is more for specialty care. It takes the average Canadian 26.5 weeks to see a specialist, which is insane, like nearly half a year. And so even though I know here in the States, we often complain about wait times, they're certainly better than other jurisdictions in the world. Related to, I think your second point was, or your third point was around, ease of doing business. I think that sounds about right, that patients would switch providers just because it's difficult to actually interact with them. And I personally have an example recently. Maybe I'm giving too much information to our listeners, but as I've been living in the US for the last year and 2 months, I hadn't taken the time to actually sit down and get a dentist. So I finally did over the holidays. So finally I'm getting dental care again after being out for a year. No cavities, guys. I'm so excited about that. But what I thought to myself, Jared, is gosh, I wish the dentist I was using would be just integrated with my other medical provider. And so I get my healthcare at Henry Ford Health System where I used to work. Henry Ford has invested heavily in MyChart to the point where MyChart is actually pretty awesome. I can book all my visits, see all my bills, message my doctor. But obviously in most cases, health systems don't integrate dental into their work. And so I thought, gosh, wouldn't it be awesome to already have all my information with the dentist, see what the bill is, have all that record in with my actual medical record. Because frankly, I had to sit there, Jared, as a new patient and fill out 10 different forms. They don't have an app. You can't book online. You have to call. And, for the last 3 or 4 years, as I've been getting my healthcare at Henry Ford primarily through MyChart, I've never really had to call the doctor. I've just done everything through the app. And so, yeah, personally, if there was a dental provider affiliated with Henry Ford, I would select it just because it truly would be easier to interact with them. So not surprised there at all either.
Nice. And great example. I'm telling you, this, I think, is going to be a revelation to people that are asking themselves, what do we mean by consumer transformation? What do we need to do? All anyone has to do is think about their own experiences encountering healthcare and those of our loved ones. And we're going to see that more and more.
Yeah. And the biggest one for me right now, Jared, is just insurance. I kind of hated that I had to give them my insurance information. And it's just for me personally, because we're at the end of it. I got my first dental appointment the 28th of December. And the next year, so 3 or 4 days later, it's actually going to be my employer got us new dental insurance. So it'll be a different provider. And so I've already had to put it in my head. I got to remind them I got to bring in my new cards, kind of re-sign up again, where, had they just been on my chart, right? I could just update my chart and everything would be dealt with across all my medical providers. So it's stupid, simple stuff like that I think gets at the core of what we mean by digital transformation. It's these small little pain points and friction that these tools can really offer patients some help on.
I understand there were some numbers that caught your eye, Zain, from the Rock Health Report.
Yeah, the Rock Health Report, love reading it every year. And I have a personal love for this report. So back when I was working in health systems and preparing a lot of content for our executive team and board, especially around the digital health space, I would go to this report every year. And so I kind of look at it or look at it every quarter. And I remember looking at this report, Jared, in 2016. And so now, for those of you that follow or read Rock Health, they put out beautiful reports every year by year, what is the average deal size and the number of deals. And I'm looking at 2016 right now. They have this report of 2012 to 2022. So a good 10 years of data. And I remember in 2016, the average, the total deal size that year was 4.7 billion, 348 deals. And I remember thinking, wow, that is massive, massive, massive. Only 10 years later, 2021, for it to be 29 billion, right? And then last year, it came down a little bit in 2022 to 15.3 billion, a total number of 572 deals. And so interesting to see that, over the last year, it's come down a little bit. I don't think that means things are going away here, but it's interesting just to see it cool down. But again, sort of going back to what we chatted about earlier, to see how far we've come and what we thought was huge back in the day or important back in the day is now no longer. Also in their report, they have this beautiful graphic where they talk about what were some of the biggest, mega deals. So over 100 million by year. And so back in 2008, some of the biggest deals that were done there was Peloton, 23andMe, and Amwell. I just think to myself, Jared, and maybe I'm wrong, but you let me know, we don't even really talk about those companies anymore. They're a little bit passé. Not that they don't do good work or aren't important, but I don't really see or hear about them in the news. Particularly Amwell, who, a lot of their products are, pretty straightforward and commoditized, where this year, the top companies in terms of top funded mega deals were Dispatch Health, which does like a lot of at-home care, Bioformis, and the RPM space, and Tiger Connect, which I'm not exactly sure what they do. And then last year was Noom and Row, which are very consumer first oriented companies. And so I guess my reflection here is just to see how, not exactly how the deal flow has changed, but what is being funded and how it's changed and how much more, I guess, sophisticated some of these companies are, and how the conversation about what these capabilities are has evolved. It's really just cool to see progress being made there, and that the industry is funding, more and more sophisticated and I guess specialized digital health companies that are addressing a little bit more of the healthcare gaps and sort of value-based health, as opposed to things that were a little bit more of a long shot, like 23andMe around their, genetic testing. And so curious what you think about some of that.
Well, you're right. Some of those brands, 23andMe, Peloton, like, really? Like, I guess that just shows it really hasn't been that long since their kind of heyday and their time in the spotlight, right, really. And then their integration into our daily lives. And I do like that trend. I like the trend of brands being so pervasive and universal that we're like, yeah, of course. Uber's always the example in my mind. I can still tell you, I didn't have an Uber ride until 2016, and I was at a healthcare conference, and I was with two other colleagues, and they're like, hey, I will just call an Uber back to the hotel. And I'm like, oh, I've heard of that. Like, it was, so I was kind of like late to the party there, I feel like. But ever since then, I'm like, yeah, of course, this is just part of my life when I'm traveling or whatever. So I think that integration does speak to the maturity more than anything of the market and of certain brands. So I think it's definitely something to keep in mind. And I like the fact that we peeled that onion back a little bit, instead of just looking at the surface and saying, okay, hey, $15 billion overall invested in digital health versus whatever it was in 2021, much higher than that. Yeah. Instead of just looking, like giving a knee-jerk reaction saying, hey, that number is a lot lower, that means nobody cares about digital health anymore. Like the knee-jerk reactions, especially on Twitter and LinkedIn, I'm just over it by now. Like, I want to really peel back those layers and say, no, really, especially if I'm looking from a consumer's point of view, is this good? Does this help? Does this give me more choices? Is this experience potentially easier? If so, then maybe it's more than just one aggregate number that catches my attention and is part of the story that's being told here. So yeah, this is kind of where my mind went. So cool. All right, so that's our by the numbers here. Let's give another little segment a shot. And this is going to be called What's Up, What's Down, Zain. So really simple, more of a lightning round, just things that are trending up or down. And this can be brands, or it can be trends or types of entities. I'll admit, I'm just going to give myself a layup here right at the beginning. I'm going to say VillageMD is up. And yeah, they kind of had a big last half of the year, this last year. And that includes their closing of the Summit Health deal for about $9 billion. And that took their number of clinics from 393 to over 680. So now you've got VillageMD with this footprint that, instantly not quite doubled, but, about 60% more clinics. And they're considered one of the leaders in value-based care out there. And now they have 200 of those stores are co-located with Walgreens stores. So I just think, what? I am a fan. It was last week's Flava of the Week, right? I'm a fan. So I think they're doing a lot of things right. Not everything. They're not the answer to everything, but I definitely think they're trending up.
That's awesome. I definitely agree. I think another one that's trending up, and I realize James Garner isn't with us today, but I would say in general, retail health. And so, at the time of this recording, especially around CVS, like we heard about their acquisition of Signify not too long ago. And then, yesterday we hear about their investment in Carbon Health. And then it hit the news today. There's speculation that they may be acquiring or investing in Oak Street Health. And so really interesting to see those retail players, continue to purchase to grow bigger, or purchase capabilities to allow them to compete essentially in the urgent and primary care space, and maybe even a little bit more into, chronic disease management and value-based care stuff. And so retail health is certainly up, I would say.
Love it. Yep. And then here's one that you mentioned to me before, so credit goes to you on this one. But Medicare Advantage practices are definitely trending up.
Yep. Yeah. And if I could jump in on that, you can almost say that's like a trend, even with the retail health crew. It's all these disruptors, if in my view anyway, that are doing really well, aren't just building or catering to anyone. They're ultimately trying to serve a very specific population. And one of those populations, happens to be the Medicare Advantage space, where, someone who comes from the consulting world, there's many consultants out there who are helping helping health systems think about their strategy around Medicare Advantage. And that's frankly just a big opportunity, both in terms of, financial upside and then also just the size of that population. And so up.
Nice. All right. Then my last one for what's up is I'm gonna say Chat GPT.
Yeah.
Kind of another layup. I mean, I don't know. Like, I feel like it sounds like I didn't do much research here, but this is definitely one that's not just being talked about, but for the potential. Now, I do like everyone who's posting about, hey, I tried it to do this and this and this. I had to write a letter to a health plan member, informing them to confirm their coverage for the year, and it spit this out. I think the administrative task, quite frankly, reminds me of like what Olive, for instance, like what their goal was of creating an AI workforce to handle a lot of the administrative burden that's out there that gets in the way of innovation. And so this is strictly on potential. I'm still giving it a little bit of time before I totally dive in. But then when I do, I'm going to go really deep and really get to the bottom of like what's possible right now. But especially the potential valuation on a potential acquisition of a public entity involving ChatGPT and OpenAI. Yeah, it seems like it's trending up. Hard to deny, in my opinion.
Definitely. I've been using the tool just for some of my own admin tasks, and it does simplify things, like especially around like taking a first pass at writing an email or some type of communication. At least for me, it gives me a structure to then go and edit. The only issue is it's not really integrated into my workflow. And so the moment ChatGPT is integrated into like Google Mail or Microsoft Word, I think all bets are off, and it's going to be an awesome tool for folks to consider. And frankly, I realize I'm the co-host on a technology focused podcast, but I'm actually not that techie. And so I don't fully understand what I'm even using or how it might help me, with like thinking about coding and things like that, which is skills I don't have. And so I think for me, I just have a lot of education that I still need to put myself through to really understand, what are the potential use cases to help me both hack my personal life and then also the work that I do every day. And so I'm with you on that one.
Nice. All right. What about anyone trending down that you don't want to mention?
Well, this might be an easy shot, but I think certainly health systems in general are trending on the down. And so there's, a report that came out from Kaufman Hall on, sort of the current state of the state on finances with health systems. Certainly some challenges there. I think health systems are still very much in a financial pickle coming out of the COVID pandemic. And what's ultimately driving that is, changes in referral patterns. In some cases, the volumes hasn't come back. But in other cases, it's just very much the staffing crunch where the price of labor has gone through the roof. Or as we talked about ad nauseum on this pandemic, the pandemic, forced some people into retirement. They just didn't want to do this anymore. And so for those reasons and just ancient service model of many health systems, again, as we talk about ad nauseum on this show, traditional health systems are certainly trending down, in my opinion. But they're savable. I will say that they're savable. We can save them, right?
Oh, right. We've said all along, hopefully it never comes across otherwise. But if anyone has any doubt, we are fans of and are rooting for and cheering for health systems and hospitals and recognize they will never go away. The healthcare professionals, clinicians will never, ever go away. That is not the point here. The point is, what shape does it need to shift into to maximize what consumers actually want and need and require to actually achieve things like the quadruple aim, things that we talk about all the time, but the boundaries that we've set to design within to try to achieve those goals, those boundaries maybe are useful if we actually change them a little bit and expand them and see things from different points of view. So yeah, absolutely. We want to see an easier version of healthcare, and whoever provides that, man, we're rooting for you. So there you go. Very cool. The only one I'd add on the downside is kind of related. They're one of the, well, we refer to this the big four in retail, but Walmart, I think they're they're at least standing still, in my opinion. I'd feel like they're trending down just because of expectations and because there's nothing clear in their leadership carousel has, quite frankly, continued spinning. And so there's nothing that indicates that, hey, now we've got it all figured out and we're going to expand this and follow the trajectory that we did when we got into the grocery business. And within a handful of years, we were the number one grocery distributor in the US and still are. Like that was the trajectory for their healthcare system and strategy from the get. And it's nowhere close to materializing in that direction. So for that, simply due to those expectations, I feel like they hopefully don't get left behind, but they're also not known to just sit by and let other people expand their offerings. I mean, they'll be back. They'll be doing something. We just don't know what.
Sure. I think that's really fair. I would put them in like the same category. Maybe this sounds weird, but like, similar to like Amazon, a lot of folks when, Amazon first failed at its couple attempts at healthcare, just assumed they'd go away. But Walmart strikes me as similar to Amazon, very much a learning organization. So if they take this first pass and aren't perfectly successful, to your point, they might regroup and come back bigger and better and bolder in a more focused or tailored area. And so I think it still remains to be seen where they're at.
Yeah, agreed. Thank you, Zain. That was great. That was What's Up, What's Down. We might do that in the future. I think that was kind of fun just to share a few headlines all at once and what we think they mean. So we're going to try one more segment today, which we'll call the consumer cocktail. How's that?
Okay.
What we see is that a lot of conversations start and end with, okay, somebody's saying consumer strategy, or they're talking about consumerism. And now the term lately is consumer transformation, which is the bigger, bolder initiative, in my opinion, longer lasting. What do those things mean? There's definitely not a consensus on what any of them mean. And so maybe we can treat it like a cocktail. And I think we can each just take a couple of turns saying like, here's one ingredient I want to add to this cocktail called consumer transformation. Like, what are those elements in it? So here's what I mean. Like, I'll start with one. The one that comes to mind for me first is digital transformation, believe it or not. And here's what I mean by that. I've shared this analogy a lot that to me, digital transformation was the plumbing that needed to happen. It was the foundation that needed to happen in order to build something on top. And the pipes just weren't going to the right places. The pipes weren't connecting. And those pipes had to do with everything from data to patient engagement to a lot of digital tools that are used to build a digital experience. So online scheduling is a perfect example. How does that tie into my chart? How does all that architecture work? So that all needed to happen. And I hesitate even saying it that way because it's not over, not even close. I mean, I think we're decades, quite frankly, from digital transformation being at the point where we feel like everyone needs to be, in most cases, where they need to be as far as digital goes. There's still a lot of just digitizing processes that were crappy to begin with. So now you have the same crappy process. It's just digital tools enabling it. That doesn't get us to a much better place either. So there's a lot of limitations there. But I do think like that is the foundation. We still needed ways to do things on a phone, on a computer, with a lot less friction. And so we have a foundation to build on now, and we just don't want to forget what to build on top. So I'd say that's one element in this cocktail is digital transformation, recognizing it's not done, but we need to have been further down that road to get going on consumer transformation.
Yes. Let's see here. So my favorite cocktail would be a old fashioned. And so I think and usually that's a bourbon focused drink. And so the bourbon that I think we need to pour into this cocktail is, I would call it like taking a design approach to whether it's your consumer, your digital transformation. And so what I mean by that, and I think we talked about this in season 1, like what are the tools that digital innovators need? And so certainly what I mean by this then is really being able to understand who you're building for as you think about, building new products and services or service lines or telehealth services. Really get clear on, the personas, if you will, the types of patients or the audiences that you're building for. And there are certainly tools to do that, whether it be design thinking or human-centered design. And then thinking through from, once you built sort of this idea of who you're serving, to then be able to carry that through into the implementation and execution of that product. And so thinking about, interaction design, graphic design, like user experience design, all those minute details, which a lot of healthcare doesn't usually focus on, right? We just think about setting up a telehealth capability. Okay, we have the ability to connect you to a physician via video, via video feed, but we don't always take the time or hire the experts to help us imagine, okay, it's not good enough anymore to have that video connection. We need to make sure that the interface looks right. Is it branded correctly? Are these icons too big? Are they too small? Should they be a different color? What's the experience like in waiting in the virtual waiting room, and so on and so forth? All these things can be solved through a design process, which, I would say your average health system doesn't necessarily have those skills to think that through. And so a design-based approach is certainly, I think, a big ounce or two, if you will, in this cocktail that we're talking about here.
Nice. I think that's great. That's a perfect addition to our cocktail here. I'll throw a couple more out here. One would be operations. I think one of the, it's not exactly a well-kept secret, right? All the aspirational service blueprints and design thinking exercises are great. And then there's this translation that has to happen for operations where first, if they were not included in the design process, then they are 9 times out of 10 just going to be like, I'm not interested in implementing this thing that you guys did. And then second off, even if they were, they're the ones who are day to day saying, okay, hey, a chatbot to help with scheduling sounded great, but it's driving our agents crazy. They're not getting appointments actually scheduled as often. And here's why. There are these daily fires that are coming out, and operations just has to be a part of this. They have to be in on it from the get. Like, they have to understand that they're a vital part of it, because you can have all the brand promise in the world, if you will. You can label yourselves as, hey, we're here to help you. We care for you. We have the best clinical expertise. We're going to take care of you. We're going to help your family members who are your caregivers who are here with you. You can say that all you want. And if operations doesn't match that brand promise, the two things kind of go together in my mind, that you need to do both. And those are vital parts of the cocktail here.
Yeah, I think that's spot on. And maybe what I'd add is, and I see this more and more now, especially in my day job as a consultant working with many health systems, I would say, maybe going back to my old-fashioned analogy, the orange garnish would just be like leadership and vision. And so, the difference in my view between, some of the high-performing health systems we work with versus more of the laggards is truly just comes down to people. It's not money, it's not brand, it's not technology, but it's like, are there leaders that are progressive enough and willing enough to step out and hold the organization towards a vision and move them along that path? When I first started out my career, Jared, I worked with Dr. Ann Snowden at the Ivey Center for Health Innovation in London, Ontario at the Ivey Business School. And she would go, in all of our classes and all of our work and say, like, innovation takes leadership. And I didn't really understand that at the time because I had no work experience and I was just a kid. But now I see it where, again, like the difference between being at the top of the market and at the bottom isn't always money or brand, but almost always people and the caliber of people that are trying to work together, but more importantly, leading the organization forward. And so, yeah, leadership, it's important.
Could not agree more. I think that's great. Well, we've got quite a concoction here going on. Maybe we'll be able to add to this over time as well.
Absolutely.
Because, there's so much to keep talking about and recognize, what are those essential elements? And I think that's a continually evolving conversation as well. So awesome. Thanks for going with me on that. And I kind of threw you into this with, we've never tried these segments before, but I thought that was really interesting.
I think we need to do it more often, and we'll do it with guests too, including James.
Yeah, for sure. Well, hey, we've got a new year. We've got essentially a new season here. So we'll keep that in mind. Any final thoughts here as we start to wrap? Again, the goal here was to provide a better idea of the state of consumer transformation right now, and just look at it from a few different facets or perspectives, if you will. Any final thoughts before we go?
Final thoughts. I don't know if it's a thought or just an observation, but I've been noticing more and more, incumbent or laggard health systems, having discussions about banding together. And you kind of see that a little bit in the market with different health systems coming together to, jointly create new businesses or products. And I just think that's going to be a trend that we're going to continue to see here. Because at the end of the day, for all the reasons we discuss here all the time, health systems are losing here. And so I think they're going to finally look for more radical opportunities and finally also like reach across the aisle and say, hey, hey, neighboring health system that I pseudo compete with in my geographic region, how can we work together to better serve this community? And I guess I'm just really thankful to see some of that going back to leadership, that, some leaders are putting their egos aside and starting to think more altruistically about pivoting their organizations to drive health and partnerships and collaboration, as opposed to just sort of protecting their camp and their business and their market share. And so I'm encouraged to see that. And I hope that trend continues this year.
Yeah, thanks. I hope so too. I hope we keep going that direction. And I do think we'll see some successes, some failures. And I think the net gain will be a very positive step in the right direction. My closing thought here has to do with where we are. And I know a few weeks ago in the Flava of the Week, I talked about a conversation I had about a comment I made that I think we're only like in the first inning here. And I was asked, okay, well then what's in the second inning? And I had to think about that when I was like, well, yeah, this is definitely the first inning of consumer transformation. We're in early days right now. And I'm like, okay, well, wait, what does come next? And I think where we'll head next, and I think we'll see a lot of progress in 2023, is a focus on the who of consumer transformation as opposed to the how, because simply we're not there yet. There's not a lot of consensus on common definitions, as we were talking about before, like what actually even is this? There's not a lot of understanding. There's not a role or a department necessarily carved out in the majority of organizations yet that says, you own this. So we need to start there. We need to first better understand who should own it, how they can grow in the necessary skills and competencies to accelerate those initiatives. And I think we'll learn that representing the voice of the consumer in the business systems and the digital infrastructure of care will have to come organically. It needs to come from within. It really does need to come from those who are in the trenches, who understand the limitations of why we haven't done this before yet, and how do we overcome them. And we're going to have to think innovatively, but this won't necessarily be the same department everywhere. Just like it isn't now. Patient experience is not rolling up to the same person in the C-suite in every organization. And I kind of understand that. So I just think we'll see some progress in substantially building up the function, but this is going to take a while. And most people just don't have patience to see something roll out over a course of years, but that's where this is going to be. At some point, there will be a tipping point. I do think this is still very clearly sitting with early adopters, and it's not in that early majority segment yet. And I'm hoping we cross over to that sometime soon, because that's where you really start to see like that flywheel turning, and you're getting a much bigger proportion of people speaking the same language and just going in the same direction. So that's where I think we're headed. That's kind of where we're at right now. And yeah, boy, lots to think about.
I think that's really sage wisdom. We'll see where we end up.
Well, man, Zain, this has been a lot of fun. I really appreciate this. Thanks so much for giving everyone something to think about. We've been speaking about the state of consumer transformation. We'd love to hear, listeners, from you. What do you think about what we said? What was right? What was wrong in your mind? Let us know. And hit us up. We're always on Twitter and LinkedIn. You can find us there. But in the meantime, just want to thank you for giving us a few more minutes, and we'll talk to you next time.
Thanks for having me, Jared. We'll talk soon.
Thanks for tuning in. If you like what you heard, please spread the word. Tell your colleagues to tune in for all the awesomeness, then leave a review on Apple, Spotify, or wherever you listen. This show is produced by Shift Forward Health, the channel for changemakers. Subscribe to Shift Forward Health on your favorite podcast app, and you'll be subscribed to our entire library of shows. See our full lineup at shiftforwardhealth.com. One subscription, all the podcasts you need, and it's all for free. And remember, we might have a lot of work to do in healthcare, but we'll get there faster together. Thanks again.